All right, let's do a quick lesson on the heart. So here we have a CT scan of a heart, and as you can see, it's not colorized, but we will work on that for future demonstrations. Now, just so you can see what we're working with here, this is the right atrium, left atrium, right ventricle, left ventricle. We've got bicuspid and tricuspid valves here, okay? Now, what we also are working with here are, what we're looking at specifically are the muscles. Now, when it comes to these muscles, we're talking about, we have the cardiomyopathy of the left ventricle here, and you can actually see, and let me actually make this nice and large for you. Look what we're looking at here in this scan, okay? We're looking at an enlarged heart muscle, which is causing a problem. All of this should be filled with blood, but it's not, because you have all this muscle in here that's causing problems. And look at how thin the edge wall of the muscle is, going all the way around, right? We want our cardio, our plasticity of our heart muscle to be very elastic. You have the septum of the heart right here coming down, right? You have the valves, tricuspid and bicuspid valve right here, all right? Now, if we look at this, what happens in the heart? All right, so we're going to take the scan of our heart. We're going to enlarge it quite a bit. Now, you have blood in this part of the heart, and it spills down into this ventricle, and it kicks out that way, comes back in, fills up in here, and then spits out to the rest of the body, out of the aortic arch. Now, if in fact we have cardiomegaly, or we have an enlarged heart muscle, or damage to the heart muscle, then you can imagine that the blood that's inside here, not very much of it gets spit out. We want all this blood to come out into here, and we want it all to come out to the rest of the body, right? But what is effectively happening is very little blood is coming out, goes into here, and then kicks out to the rest of the body. And because we have an issue with this muscle wall not being very elastic, right? So we want it to expand out really far and then expand back in. But because it's not very elastic, very little blood actually comes out to the rest of the heart. So that's just a demonstration of what we can do when we have models inside. Look at the other side of the heart here. We can do a quick demonstration. We have arteries and veins that come down the heart and wrap around. Okay, so this is just a quick demonstration. When you have a model in TiltBrush, you can expand it as large as we want. We can get really nitty-gritty and get in here and discuss the finer details of what we're looking at with these valves, with this muscle wall, what this means when we have conduction, right? And we have the SA node firing to the AV node firing down the bundle of his, which comes up this way. There's so much we can do. All right, all done. How do I just clear the whole